What up? Good afternoon, everybody. I'm going to say good morning, but I did not. Good afternoon, everybody. It is your truly Dr. Barry, your favorite board-certified internist, founder of drprsblog.com, podcast host of the Lunch and Learn with Dr. Barry, and I am welcoming to episode 46. Exciting time today. We're going to be talking about lupus. Why are we talking about lupus? For a couple different reasons. One, because one of my followers requested me to talk about lupus. And of course, if you have requests, like I always say, if you have requests on a topic I have not touched on, please feel free to let me know. Sorry. If you have a topic that I haven't touched on, please feel free to let me know. I will gladly make sure we incorporate it in our Lunch and Learns. And second of all, the topic of lupus is actually very important to me and very special to me because my first patient had lupus, right? So we're going to get started today. We're going to be talking about lupus. We're going to be talking about some symptoms of lupus. We're going to be talking about some facts regarding lupus concern. We're going to be talking about my patient who had lupus as well. So sit tight. I'm just going to, do our little thing what we always have to do, or I have to do a little housekeeping and share to my personal page. Because again, like always, not everyone follows my business page, so I gotta let them know, that we're gonna get started. So we're gonna get started in just a bit. Hey, Amanda, thank you for joining. All right, let's get started. Okay, a little different here. I'll share a personal timeline. Yes, I do. Okay, so we're back again. Apologize for delay. You have to do this thing every time we get there. Facebook actually changed the way I usually do it. Before I used to be able to go directly to my page and share it, but for some reason couldn't do it back then. But it doesn't matter. We are here now again. Welcome to the Lunch and Learn with Dr. Barry, and today we're going to be talking about lupus. This is a very special topic for me because my very first patient out of residency, I was about to say medical school, but no, I actually had a residency. I was a full-blown, quote-unquote, attending status, and my very first patient walks into my office, and it's a patient with lupus, and it was actually a patient who was diagnosed with lupus nephritis. So we'll get to the specifics on that type of lupus, but it was very interesting to me because, here I was thinking that I was going to walk into, my office, and maybe I have to fill a couple blood pressure medications out, or tell a person they're diabetic, and right off the bat, like, I was thrown into this pretty intense topic, because lupus is definitely something that, as a private primary care physician, is not something that you see all the time, especially if you're not in that specialty. But it was something that, yet again, she just kind of walked in to the office, and here I was, like, I was her doctor. She had just got a new insurance plan, and she was looking for a new doctor, and I just got out of residency, and I just got on some insurance plans as well. So here I am, boom. And it was very exciting. Again, my very first patient, I actually talked about her on my blog when I talked about saying goodbye to the PCP, right? She was my, and in fact, no, I actually wrote a blog specifically on her about saying, goodbye to my very first patient, because she actually had to leave me, unfortunately, because she changed insurances, right? So I thought I was going to leave her first, but she left me first, but that's okay. And we're going to be talking about lupus today. It's a very interesting topic. It's one that as a primary care physician, I have to always be keenly aware of, because most of the time the primary care physicians are the ones who diagnose it. And unfortunately, in my patient's case, when she was diagnosed with lupus, it was after the fact. And unfortunately, that's actually not a uncommon, way to diagnose lupus. Is a lot of times when all of these constellation of symptoms, and we're going to talk about the symptoms in a minute, when all of these constellation of symptoms kind of happen, a lot of your patients end up in the hospital. And they end up in the hospital, and you're trying to find out why. You're trying to tease out all these different reasons, and there's usually a diagnosis after you've kind of tried to eliminate all of the the bread and butter stuff, oh my god, this person has lupus. So we're going to talk about lupus today. It's a very interesting topic. It's not something that's quite as common as last week's disorder when we talked about diabetes, but it is in the same family when we talk about an autoimmune disorder. And if you guys remember when we talked about in episode 45, an autoimmune disorder is a disorder where the body begins to attack itself. And the way lupus works is something in the body, and we're still not entirely sure what. We're not sure if it's environmental. We're not sure if it's genetic. We're not sure if there's an infection that turns everything on. Something happens, and your body starts turning on its own self, and it actually starts destroying certain cells, certain cell tissue, and that's where that constellation of symptoms start and begin to occur. And we talked about with the autoimmune issue being it's a chronic process, right? So it's not something that goes away. It's not something that you get as a child and you get rid of as an adult. Most of the people who get diagnosed with lupus, they're usually between the ages of about 19, those teenage years, up to about 55, 60, right? So there's a very wide range of, from an age standpoint of when you can be first diagnosed with lupus. And we'll talk about the three common types. And I said three common types because there are several other types of lupus, but the three common that we tend to know. And even for us, when we say lupus, especially in the general public, when the general public tends to say lupus, they're usually talking about one specific one, and we'll talk about that later on today. But there are three common types that we tend to know, especially as a primary care physician, because that's something that's going to walk into your office. And if you're not prepared and not ready for it, you haven't studied up, it is something that can easily be missed. And so talking about lupus follows what we call a waxing and waning pattern, right? Meaning that for a person who may be diagnosed with lupus when they're 21, 22, 23, and they get quote unquote treated, because again, it is an autoimmune issue, so you never really get treated from it. You just kind of ride the storm out. It can come back. And we're not sure if it comes back in a year. We're not sure if it's going to come back in 5 years, 10 years, but it can come back. And in fact, it usually does. So it's usually not something where you treat it that one time and you never have to worry about it again. So it is something that we're very mindful of, especially when we're diagnosing our patients at a very young age, to let them know hey, this is something that you're going to be dealing with pretty much for the rest of your life. So we have to kind of be ready for it and be able to deal with the problems when it comes about, right? So that's why it's so important to, one, diagnose it early, right? It's important to diagnose it early. And two, it's important to educate your patient, because I have a lot of patients, and especially my practitioners who are watching probably agree with me, right? I have a lot of patients who, the second I treat them with, let's say, a blood pressure medication, in their mind they don't have high blood pressure anymore. Second, I treat them with a diabetic medication, in their mind they don't have diabetes no more, right? So we have a lot of patients who kind of fall into that pattern, right? So it's very important to teach and train your patients that yes, we're going to treat, yes, we're going to take care of this quote unquote episode of a lupus, and what you'll tend to hear a lot is called lupus flare. So we're going to treat this episode of the lupus flare, but next time if it comes about again, you have to be very mindful. You have to be very mindful of when it can occur. You have to be very mindful of the symptoms to try to catch it earlier better than later. And I alluded to lupus, being about, 90%, right? So 90%, right? Because we talked about my first patient, my very first ever patient, being a she, right? 90% of your patients with lupus will be female. And what's worse is that even I say we're worse, but what even more significant is that an African American female is 2 to 4 times more likely to suffer from lupus than a Caucasian or Hispanic female, right? So it's so rampant, right? Let me tell you how rampant it is, and my medical students and residents would definitely agree with me. If I am looking at a medical test question, right, and the subject, listen now, like this is how common it is. This is how common the medicine world thinks it is, right? If the subject is a black female, blah 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 blah, I can literally scroll down the answers and look for wherever one's going to be about lupus. Like that's, and if it's not lupus, it's another one that we may talk about, may not, called sarcoidosis. But that's how common it is, right? It's so common that in my test questions, and I'm talking about when I was taking questions in medical school, when I took questions, when I was doing questions as a medical resident, the same block of questions, right? If the subject was a black female, like almost like 8 to 9 times out of 10, if I looked at the answer choices, lupus had something to do with the answer choices. So that's how common it is in that population. Now it's not as significant. Again, about looks like 1.5 million people suffer from lupus on a yearly basis. But the concern is that it's the leading cause of premature, and remember because it strikes so early, premature cardiovascular and kidney disease and strokes in a patient, in a younger patient, especially female patient, right? So anytime you suffer from any disease, whether it be a heart attack, whether it be stroke, whether it be some type of kidney disorder at such an early age, lupus is a prime example. And again, going back to my patient, when she was coming to see me, she had just got out of the hospital. And let me tell you how long she was in the hospital for months, right? She was in the hospital for a very, very long time. And that's because the lupus had gotten to the point where it affected her kidneys. So we have, and that's why I said, especially as I put the call out to our primary care physicians, and even though I hate that term, and we can discuss why I hate the term primary care at a later point. But for primary care physicians, it's very important for us to really be very mindful of the symptoms early, right? Because this is a girl who, if she would have been diagnosed earlier, we would have caught that disorder earlier, she wouldn't have ended up in the hospital. She wouldn't have had to miss months at a time of her life, at a young life too, because like I said, she's pretty young. She wouldn't have to do that if we would have caught it early, right? So that's why it's important, very important, again, especially when you hear about lupus and you hear about these disorders, that a lot of times early prevention and catching it early has always been key. It just always has been. There's really no ifs, ands, buts about it from that standpoint there. And we're going to talk about the 3 types of lupus. One, and again, most people when they talk about lupus, the lupus they're talking about is systemic lupus. It's a systemic issue, and again, we'll get into the nitty-gritty of what systemic means, but you can kind of guesstimate that. Cutaneous lupus, and then drug-induced lupus, right? So these are your 3 most common types of lupus, worldwide, right? So from a person who suffers from lupus, they would tend to fall under those 3 categories in there. And there's some people who can kind of have mix and match categories where they present as one but then end up being the other. Most importantly, let's talk about the symptoms, right? The symptoms of lupus, and symptoms that, again, and I'm going to say these symptoms are going to sound very common. Not saying that you should brush them off, but if a lot of these things really start hitting home, especially if you're in that young age group, that that 18 to 30, and you're just not feeling well, and all these symptoms about the name, if that's not you, make sure you go talk to your doctor about it, because you'd rather be safe than sorry more than anything else. So we talk about lupus, right? So these are the symptoms, and when we talk about diagnosing lupus is a constellation of symptoms. So it's a whole bunch of symptoms, and based on how many that you meet from a criteria standpoint, decide whether you have lupus or something else or something not from that standpoint there. So number one, we talk about joint pain, muscle pain, hair loss, fevers. Some people suffer from sores in the mouth, pink and purplish fingers or toes. And the reason why that's important, because lupus can attack the vascular system. And for patients who suffer from, like, they get their fingertips get very cold or they change color, the vasculature, like the vessels, the further we get away from the heart, the smaller they are. So lupus is more likely to kind of attack and destroy those smaller vessels, and then you don't get any blood flow in your fingers and your toes. So always be important to that. They have this, most people know, is the sensitivity to sunlight. They cannot go out to the sun because they get this like huge rash, that is very telling for them. And fatigue is a big one, right? They are always tired. And I'm not saying tired as if you just, got out of a 12-hour shift, right? These patients are like just deadbeat tired. When they wake up tired, they go take a nap, they're tired. Like, they're just always tired, and nothing seems to kind of get them over a hump. There's no 4-hour energy drink. There's no coffee. There's nothing that they can take that's going to give them a boost of energy. These people are just always physically, mentally tired and moving forward. So that's fatigue is a big one. Kidney issues, chest pain, chest discomfort, especially when we're taking some deep breaths in. So a lot of these symptoms. So I just I listed a whole bunch of them. So I listed about 11, 12 symptoms, right? And for your patients with, and these are just like symptoms what you may tell your doctor. There's also some blood tests that we in our office tend to do as well. And they're usually autoimmune tests, or tests to see whether you're anemic, or tests to see whether your kidney functions are normal. So these are those tests that we tend to do, right? Because again, we're trying to get to the bottom of why you're feeling the way you're feeling, right? So what tends to happen? Hey, Dr. Sonia, thank you for joining. What tends to happen? We just try to piece together all of the puzzle, right? We try to get here you got this symptom here and this symptom here, and you kind of have this symptom here, so you have a more likely probability of having what we can concern for lupus, right? And again, lupus is it's an autoimmune disorder, right? It's your own body attacking yourself, and regardless of how smart our medicine is, right, we have not really found out why this happens, right? We think it's genetic. We think it's environmental. We think it may be infection related. We meet the family history. We think something may turn it on, but we're not sure what. Because again, I have some patients who they get it when they're 18, 19. I have some patients who don't get it until they're 30. I have some patients who don't get it till their 50s, right? So there's no really rhyme or reason of why it actually starts. We just know when it does come on, it can be significant. And as the primary care physician, as your physician in general, because most of the time your lupus patients are taken care of by specialists who deal with autoimmune disorders. Those are our rheumatologists. But a lot of times the first people on the forefront who are diagnosing it early is usually are the primary care physicians for that part there. So again, we talked about a lot of symptoms. We talked about some blood tests. Again, it's not important for you guys to, because again, I don't want you to run into your doctor's office saying, hey, test me for lupus. I want you to be very mindful of, I'm having a lot of these symptoms that that Dr. Berry said. Maybe I need to test for lupus, right? Because we get a lot of that too, right? So I have patients who, they go read their Googling, they do the Googling, they read it, and then all of a sudden they got lupus, right? And then I have to turn around and calm them down and relax. Say, hey, you know what? You're okay. You don't got lupus. You got all of these symptoms that are not consistent with lupus, but relax. But if you feel like, a lot of these symptoms are kind of pointing to you and they're talking to you, and you're like right here, what? I always knew something was off with me, but I'm not sure what. I always say, err on the side of caution, right? That's the most important thing. Because so let's talk about the three common types, right? So we talked about SLE, right? So when most people talk about lupus, we talk about systemic lupus. And the problem with this lupus, right, it's the most presenting common one, right? But because it is systemic, right, and if you can just think about it, it affects every organ in the body, right? Every tissue in the body, skin, kidney, the brain, nerves, heart, lungs. There's not a organ in your body that cannot be affected by lupus, right? Now, that's not to say that if you have lupus, you're going to have a disorder with your kidneys and your heart and your lungs. No, but it is to say that it's not a shocker if you have a disorder in any one of those things, right? Again, pointing back to my patient had kidney disease, right? Like, that's how she presented to the hospital. She presented to the hospital in full-blown kidney failure, right? And for a person her age group, there's no reason for you to have a kidney failure unless there's something from an autoimmune aspect totally wrong, because she wasn't like a drug dealer or anything, or a drug user, something from that standpoint. So that's the systemic one, right? So that's the one we're always concerned about. That's one you tend to see much more from a TV standpoint. But there are some, again, for type 2, there are some that are just affecting the skin, right? And lupus, the hallmark picture of lupus is that the butterfly rash, this rash that kind of like lands on your cheeks here, but doesn't really cross, these navel folds, right? So they're just like right here, just red. Of course, I'm dark skinned, right? So you're probably not gonna see redness on me, but for most people, like especially the fair skin one, they have this rash that's kind of inflamed here, but just stops. We're not sure why it stops. We just know right there, you're not getting a rash, right? And for those patients who get that type of rash, we're on high alert. Oh, this may be a lupus one as well, right? Remember, like I said, the systemic one affects everything, right? So you can get the same type of skin disorder rash in your systemic one, right? But for patients who don't have any kidney issues, any liver, any other issues but the skin, those are treated much differently, but those are categorized as the cutaneous form of lupus, right? So again, we have the systemic one that affects everybody. We have cutaneous form that affects just the skin, and it affects the skin not only with the rash here. Some people get blisters. It's a diffuse rash that can happen everywhere and anywhere, because again, lupus does not discriminate. Lupus can happen in any part of the body it wants to, especially for the skin related one. And I've seen some instances where the skin one even affects infants, right? So even the infants are getting these, this squamous rashes that just look really, really bad. And it's when we see something like that, we're on high alert. That lupus may be playing a key factor here, right? And then the next one, our last one, is drug-induced lupus, right? And it's just like it sounds, right? There's drugs that we, professionals will give, the physicians can give you that can possibly cause lupus, right? And I will tell you right now, it is not common, right, to get this reaction, right? But we do always have to let you know that it can occur. And for most people, right, probably the most common medication we're going to think about is probably hydralazine, which is a blood pressure medication that we give to patients who have problems, dealing with blood pressure, and they need something else to kind of assist with dealing with their blood pressure. So hydralazine is one. Second one is quinidine, and the third one is procainamide, right? So these last two you may not be too familiar with. Reason why is because they're really more a function of heart rate medications, right? So again, that's a very small subset of the population that's probably going to ever have to deal with like that disorder, right? But for the most part, hydralazine is probably going to be your most common one. It's probably going to be the most likely one that someone outside is going to prescribe you. We do it. We give it a lot in a hospital setting for patients because it's a great blood pressure medication. So we give it a lot for patients dealing with blood pressure and blood pressure issues of the sort. So those three right here, and there's about 45, 46 of them, but those are three of the most common ones, right? The other like 40 other disorders, they happen at such a small rate that we don't even really consider that a disease. But because it happens to one person, right? And I'm glad I got to this point because this is a nice little caveat, right? I have a lot of patients who love to read the side effects of diseases, right? Side effects of their medications, and I always have to explain to them, right? If I test 1 million people, right? Listen now, if I test 1 million people with a certain medication, right? If one person tells me that it turned their hand blue, you have to list that as a side effect, right? So think about that, right? 1 million people, and out of 1 million people, one person, right, had a side effect where the hand turned blue, and now boom, what happens right on the label? Take this medication, you run the risk of your hand turning blue, right? because the pharmaceutical company, which for good reason, they can't hide it. We don't want them to hide it. We want them to be as forthcoming as possible, right? But they got to be like, well, this can occur, so we're just kind of letting you know. But I always let my patients know that too, because my patients run back to me, hey, Dr. Pierre, you gave me this medication here, and it says this is a side effect. I said, that's a possibility, but it's a very low risk of it, right? So always feel free to educate and quote unquote check your physician if you're ever concerned about medications from that standpoint there. And we're gonna get into our segment now. Again, I keep saying we, but again, for those who maybe you're just now catching up, I am in a different office, as you can see here. You can't even see my office is a little bit smaller now, and I'm on my desk. And in my new job setting, right, I deal with inpatient medicine, right? So what we're going to start doing with these lunch and learns is we're going to start having inpatient medicine discussion, right? So we talked about lupus, right? So what does lupus look like on the inpatient setting? For example, my patient who came in, she came in with acute kidney failure, right? Which means her kidneys were failing on her. Her kidneys were not producing urine. Her kidneys were causing her to be bloated. Like all of these bad problems that with lupus, to diagnose it, they actually had to biopsy her kidney. So when she was coming to see me, it was because of that, right? I was actually, clearing her to get her kidney biopsy from that standpoint there. So that was that, right? So in the hospital setting, right, when we tend to see patients with quote unquote lupus flares, it's usually the lupus, right, attacking some portion of the body, causing it to temporarily not work, whether it be the heart, whether it be the lungs, whether it be the kidneys. Those are usually our three top ones. We know lupus is a result of about 140,000 hospitalizations per year, right? So 140 hospitalizations per year. And in the hospital setting, I'll tell you now, so I always like to tell you about the business aspect of, everything I'm doing, right? In the hospital setting, right, the big thing in the hospital setting is what we call readmission, right? And readmission means if I discharge a person tomorrow, what is the likelihood that they'll come back within the next month, right? Because if that happens, right, especially if they come back for the same thing, that usually says that, hey, you know what, you may have discharged this person a little bit too early and they probably weren't ready or something happened. Because a lot of times it's not always your fault. A lot of times you'll discharge a patient. You'll tell the patient, follow with your primary care doctor. They don't follow with their primary care doctor, and then they don't take the medications that they were supposed to take when they followed the primary care doctor. Then they end up in a hospital, right? That's a very common issue we see a lot in the hospital too, right? And that transition of care always falters, right? So much important to always kind of be mindful of that when we talk about the hospital setting, right? And readmission rates, right? But for lupus, right? Lupus has these 6 most common diagnoses for a person to be readmitted to the hospital within 30 days, right? So think about that, right? The 6 most likely cause that you're going to end up back in the hospital within a month is due to lupus, right? So it's definitely not something that we take for granted, because we know how significant this disease is. We know how, and even if the numbers aren't as rampant as, let's say, a diabetes, right? We talk about diabetes, 30 million, right? Lupus, again, hits about, I think, 1.5 to maybe 2 million per year in that regard, right? So, of course, obviously, there's a big difference, right? But it doesn't mean it's not important. And I think that's the most important thing, right? And so that's why I wanted to touch on it, because, again, I do have, especially in my apartment, I'm listening to see if someone's calling me overhead. Especially in the patient population I deal with, a lot of them obviously are African American, and so a lot of them are going to be much more affected by like a disorder like lupus than my Caucasian patients, right? So always important to make sure I touch on everything to make it important. Plus, I wanted to kind of dedicate this episode to a friend of mine, Dr. Jamie, who recommended that I do an episode on lupus. So here we are, right? Like, first of all, thank you, Dr. Jamie, for giving us an idea to talk about lupus this week. And that's about it, right? So again, I don't like to keep you guys too long. I'm not sure how long we've been going on, but that's lupus. That's pretty much lupus in a nutshell. And on Thursday we'll be having the podcast episode. We'll be go into lupus as well. I even talk a little bit about treatments, even though I try not to go too much into treatments, because treatments is always so case specific that if I listed a certain medication, I don't want you yelling at your doctor because you're not on that certain medication, right? So you guys have a great, blessed day. Thank you for joining another edition of the Lunch and Learn. We're on episode 46. It's been amazing. We're about to hit 50 soon. I don't think I have anything crazy planned for that, but about to get 50. So you guys have a great, blessed day. I'll see y'all later. Bye.